I think you can agree our healthcare system makes it expensive, difficult, and sometimes even impossible for people with T1D to get what they need to live. But why is that? Well, we're going to talk about that with Dr. Len D'Avolio. He's the CEO and co-founder of Blue Circle Health. He spent over 20 years working to improve healthcare, and he's an assistant professor at Harvard Medical School and Mass General Brigham. We're going to talk about why our healthcare system makes living with T1D so difficult and how Blue Circle Health hopes to change that. Len, welcome. Thanks for talking with me today. Your experience innovating in healthcare spans decades. If you had to, how would you distill your experience into a few major moments leading into what you're building here at Blue Circle Health?
Sure. Well, 2 decades, right? I feel old when you say decades, so I feel even older when you say decades. How would I distill my experience? I got into healthcare because I was, at the time, I was amazed with what was going on in other industries. And again, I'm dating myself a bit, but we were watching as information technology was making it possible for companies like Google and Facebook to come into existence. And then even existing organizations like FedEx and Walmart, like they were all transforming their business because of information technology. But information technology is a tool, and I started out as a software engineer. What made me most interested in that set of tools was it really made it possible to learn at speeds that were never before possible. And so organizations like Amazon, they were selling books, but that was a means to an end. They were learning how to sell things, and they could learn faster than anyone. And I thought, if this new set of technologies, if its superpower is learning, what if we applied that into healthcare where we have so much data and so many challenges to overcome? And so I went ahead and pursued a PhD in the application of data science to healthcare specifically, and learned things like natural language processing and data science and machine learning. And then I can remember quite distinctly creating a software that was able to predict what patients were most likely to end up in a hospital. And we validated it, and it worked very well. And we brought this to the executives of the hospital that we were affiliated with. And we said, imagine what you could do. You could predict which patients are heading to the hospital, and then you could prevent it. And I remember quite clearly him saying, and if we did that, we'd be out of a job. And that was probably the most eye-opening thing for me, having just focused rather idealistically or naively on what the tools could do. I didn't until that moment fully understand how important the incentive structure of healthcare is for learning and improving. And since that moment, that was near the end of my PhD studies. But since that moment, I was very intentional in every project, job, company, team, program that I became a part of after that, was very much focused still on learning and improving, helping people get better. But I was very intentional in identifying projects where the economic incentive was such that it actually paid to keep people healthy, as opposed to how 95+% of healthcare is currently reimbursed. It's called fee for service. But in most of healthcare today, those clinics and those hospitals, they don't make money until you're sick. And so my career path has bounced in and out of for-profit, nonprofit, academic, public health. But what every project had in common was there was an opportunity to learn and improve at incredible rates, and there was economic incentive to improve. And Blue Circle is just, the ultimate sort of culmination of that. Anytime you have a fixed budget to keep people healthy, you now have incentive to do things before they're at the height of their illness. And that's where we can really make tremendous strides in healthcare.
When I think about trying to wrap your head around the economics of healthcare, aside from all the cool data stuff that you were doing, it could take 2 decades to learn just that model in and of itself. How was that experience for you, learning that side of it?
First, I think anyone going into healthcare should take a minute to understand, well, what are the economics of this clinic or this health system or this company that I work for? Because it really is the case in healthcare that how the money is spent dictates the outcomes that you get. I won't go too deep in all of the different contracts and types of contracts, but I will say this. right now in this country, we spend more than any other nation by far, both per capita and also total dollar amount. And year after year, when international health organizations assess who has the best and the worst outcomes, the U.S. is consistently at the bottom of all developed nations. People die sooner than they need to, infant mortality, maternal mortality. We continue to rank at or near the bottom in most of the major measures of whether or not your health system is keeping your population healthy. And it is not because we don't have the best doctors in the world. People fly from across the world to attend our universities. It's not because we don't have the best technologies or drugs. So many of the drugs that have made such a difference in millions of lives come out of this country. What it ultimately comes down to is we pay for volume and complexity. We don't pay to keep people healthy. That's called fee for service. So at the highest level, the one thing you need to understand related to healthcare economics is when 95% of reimbursement in this country is based on delivering more care and delivering more complex care, you end up creating a system that underinvests in things like prevention, education, ongoing support, all of the things that you need to be healthy in a condition like type 1, but really so many of the other chronic complex conditions, whether you're talking about heart failure or CHF and so on and so on. We do our worst as a country on diseases that benefit from ongoing preventative care and ongoing support because all of the money is made in acute triage, hospital-based, procedural-based, big money drug-based type conditions. This is a wonderful country to be diagnosed, to need a knee replacement. It's a wonderful country to we do great actually with cancer and major surgeries because those are acute, traumatic, transactional healthcare. And we fall down when it comes to things like type 1 or type 2 or so many of the other chronic complex conditions.
Let's talk a little bit more about why type 1 diabetes feels so hard to manage in the existing healthcare system.
As you know, Scott, I don't live with type 1, but an important part of my job is understanding as best as I can what are the challenges, but also how do we communicate those challenges? Because I find that unless you live with or have a loved one with this condition, most people don't understand how challenging this condition is. And I think the best metaphor I've heard to date comes from a young researcher, Dr. Alice Carr, out of the University of Alberta. And she did a presentation. And when I saw this slide, I immediately sent her a note and we had a great conversation about it because it really resonated with me. And her metaphor was type 1 is the plane that never lands. And I thought, well, that's really powerful because in her analogy, basically, you walk onto an airplane and now you learn that you're the pilot. You didn't ask for this job, but now it's your job. And in order to keep that plane in the air, you need to account for all of these conditions that are thrown at you as you're taking off and flying. And that includes you need to understand your current blood glucose levels, the food you're going to eat, the things you're going to drink, the effects of exercise and stress and sleep and hormones. And you need to understand all of this plus manage life in general. And your fuel is, of course, insulin. But you need to be able to account for all of these conditions in applying the right level of fuel. And to help you do that, you have your instrumentation, your CGMs, in some cases, your automated insulin delivery systems. Now, the consequences of not keeping the airplane in the air are pretty dire, right? So it does resonate in that you're now responsible for keeping yourself alive, and you're always making adjustments in order to do that. I just thought it was a really powerful metaphor because you didn't ask for that job, but now it's your job for the rest of your life. And you asked the question, why is it so hard beyond that? To me, that's already so intimidating. But we know that people can, and it's possible to live a long and healthy life with type 1. It's not easy, but it's possible. If you have access to fuel, the insulin, and the instrumentation, and you've been trained to process the mathematics of staying airborne. But here's what I think is just a terrible injustice that most people don't understand. Our healthcare system is designed to make it more difficult, more expensive, in some cases impossible, to gain access to the fuel and the instrumentation and the training that you need. And I think that's the greatest miss thus far in the design of our current healthcare system when it comes to type 1 is it assumes that type 1 can be successfully treated like many other conditions where you go in, you get what you need, you leave, it's triage, it's quick, it's 15 minutes. But if you think of it in terms of the plane that never lands and your job is to keep it afloat, we would never hold back fuel from a pilot who needed to stay in the air. We would never make it harder for them to get access to instrumentation that can tell them what's going on as they fly. And we certainly wouldn't expect them to fly the plane without training. And yet that's what we've done as a society. And there's the opportunity, not just for Blue Circle Health, but for anyone that's paying attention to what we're trying to do, for anyone that believes that care for T1D could be better. The opportunity is to rethink, well, what are the real challenges here? And how do we deliver care, holistically care, in a much more productive way based on the fact that it really is your job and the jobs of people with T1D to keep the plane in the air. It's our job as a healthcare system to make that as easy as possible so you can be successful in this lifelong job that you never signed up for. I don't know if that's helpful in thinking about it, Scott, but for me, that was very helpful.
That's a very good description of what a type 1 diagnosis is like. So we know that there's this big problem in type 1 diabetes. What can you share about what Blue Circle Health is and how that addresses those problems and some of the bits and pieces of conversations that led you into building Blue Circle Health?
The problem is the misalignment between all of the things that people need to live a long and healthy life with type 1 versus what they currently get from our healthcare system. And so Blue Circle Health was designed in direct response to that. This is really the brainchild. The idea of Blue Circle Health comes from David Panziera, who's one of the trustees at the Helmsley Charitable Trust. That's a private foundation, and one of their major areas of interest is improving the lives of people that live with type 1 diabetes. It is a free 6-month clinical care, education, and support program offered to adults living with type 1 diabetes. It is free, but not a free clinic in the traditional sense, because from day one till the up to 6 months that people stay, our goal is, of course, to equip them with whatever they're missing. If they need access to insulin, insurance, it's make sure they're connected to a primary care physician or an endo. So there is an aspect of triage equipping them so they have the basics. But the bigger goal here is we have 6 months to prepare you for this lifelong journey, to educate, to empower, to skills build. And 6 months is enough time that together, both the team and participants will experience some of the highs and lows and be able to debrief on that and better prepare them to continue on with what is necessarily a self-managed disease. So that's Blue Circle Health. But if we can do this and do it well, and at this point, we've now helped over 1,000 people in 17 states, plus the District of Columbia. I think by the time this airs, we'll be in 20 states. Our goal here is to show not just the T1D community, but the healthcare community that better is possible, that we can achieve much better outcomes, potentially, and we're still measuring this, but even spending less money, but spending it on the right things, education, prevention, support. And so, yes, our goal is to care for as many as possible, but we're also trying to become a beacon. We're trying to shine a light on the fact that better is possible, and we're measuring very carefully whether or not we can achieve much better outcomes by simply designing the care based on what people with this condition need to be successful.
Well, while we let that sink in a little bit, let's just take a quick break.
Hi, I'm Erica. I am part of the Blue Circle Health team, and I've lived with type 1 diabetes myself for 25 years. One of our favorite things is sharing stories from people who've participated in the program And I have one here from Candace, who's been living with type 1 diabetes for 36 years. I'm going to read it for you. The challenges to living with diabetes have been mostly the hurdles I jumped to obtain the best health insurance possible. That need has driven many of the job choices I've made and relationships I've endured. The 15 minutes that my endocrinologist is allowed to spend with me is not enough to read and analyze the data from my devices, let alone inquire about my overall wellness. That standard of care is driven by profit alone. It quickly burns out the providers and patients come away dissatisfied. On the opposite end of the spectrum, Blue Circle Health has provided me with excellent care by exceptionally qualified endocrinologists and stellar emotional support, none of which is driven by profit. The difference is night and day. There is enough time allotted for me to feel seen. There are good answers available to any and all of my questions, and the level of kindness provided is off the charts. And it's free. Thank you, Candace. We really appreciate you sharing with us.
In each episode, I like to give a quick shout out to one of the many amazing organizations helping people with T1D. Listen, this is no sponsorship. This is not an ad. In fact, they don't even know I'm doing this. It's just me showing some love. And for this episode's Community Partner Spotlight, I want to talk about Diversity in Diabetes. Diversity in Diabetes is a nonprofit organization that knows a lot about treatment options for people of color living with diabetes. In addition to several programs aimed at creating a more equitable landscape in diabetes management, their monthly insulin-inclusive virtual meetups are an easy way to check them out and get involved. Head over to diversityindiabetes.org to learn more. Len, welcome back. So change in our healthcare system, it feels so big that I don't even know where to start. And I even wonder, is it possible? How do you approach such an ambitious goal using Blue Circle Health as the model? What needs to happen here to start moving the needle?
Well, there's two things, right? This change at the macro level, which I won't say impossible because it has happened. Like there's been major periods of change in the U.S. healthcare system over the years. It was during the World War that we attached insurance to employment. Like that was major, right? We formed the CMS and they issued Medicare and Medicaid. Like there have been major periods of change in the U.S. healthcare system, but they're precipitated by crises. So, and in any policy, any opportunity to bring a policy to life, there's a thing that's been studied called policy windows, right? So you never let a crisis go to waste is like a saying in politics. So what it would take to change things at the macro level is, number one, a crisis, the widespread recognition that healthcare is broken or something needs to change. And quite candidly, I think we're nearing that, right? If we continue at this pace, healthcare expenditures alone have the potential to bankrupt this country. And in the process of spending more than any other nation, we consistently deliver terrible results. And with some of the recent policy changes, we're now seeing premiums jump through the roof. So this is becoming more real for everyone. And you can see healthcare is now once again becoming this major political issue. Our job is to be prepared by showing the world that healthcare can be better. Now, what we have control over is one particular disease domain, but if we can demonstrate that you can spend less money and achieve much better results at a moment when the nation is looking for examples of spending less money and achieving much better results, I think we'll be well positioned. And this is exactly what we're aiming for. Again, on the one hand, our job is to care for as many as possible, but it's not lost on us that we're now in 17, soon to be 20 states and DC. And we're talking to the health plan executives in every state we go to policymakers in every state that we go to. We work very closely with organizations like the American Diabetes Association to help them understand what we do and to spread the word that better is possible. So while we're working to deliver direct care, we're also working to show the world that care can be better and different. And as I said to David Panzier and the folks that were funding this, look, I can't change healthcare policy, but if healthcare policy starts to change and we are a ready-made plug and play, already there example of delivering care better and at lower cost. Or if in demonstrating what we're doing, if we can demonstrate our results and show that we're doing better, if people adopt even parts of what we're doing, for example, we connect everyone to a community. I think every clinic could prioritize connecting people living with type 1 to other people living with type 1. We don't require people to see an endocrinologist before they can see educators. I think this is like a simple policy change that would save money because most everyone could benefit from education. And we think there's dozens of examples like that where with us doing common sense things and sharing that as widely as possible, at a local level, some folks might adopt it. At a national level, we might be positioned to become plugged in to what comes next. So that's the goal.
You talked a bit about working with the different payers and healthcare systems. How are the actual healthcare professionals that we're talking with, how are they taking this?
I think there's two stages to the conversation. If they've never heard of us, then anything that's free in healthcare sounds too good to be true. There could also be the perception that we're stealing patients from their panel. Once they come to know us, the feedback we're getting is, you're doing the things that I can't do because I have to practice within the current structure, within the current reimbursement policies, within the current framework. So the fact that we can see people between their visits to their endocrinologist, that's helpful to them. They all went into medicine to help people. So if we can be there to help people in between, that's wonderful. The fact that we can provide more education, then oftentimes they can connect. The fact that we have behavioral health support specific to type 1 diabetes. So many of the providers we talk to say, man, like that's just not available. It's wonderful that you're doing that. So I think our job is to, of course, help the participants in our program. But to be successful in doing that, we need to be helpful to the doctors and nurses and educators that we partner with. And our number one source of participants in the program today is referrals from 120 plus clinics across the states that we're in. And we're proud of that because it means that they recognize the value we're adding in helping to make the folks they care for healthier.
What opportunities within this challenge of re-envisioning type 1 diabetes care, what opportunities do you see?
The first opportunity is to communicate the challenges, right? If people don't understand the challenges that the type 1 diabetes community faces, we won't get enough attention in solving them. And it's something like 0.5% of the population lives with this condition. So it's easy for it to get sort of hidden under the larger bucket of diabetes or to be misunderstood. I think our job is to both care for people, but to raise attention to what could be. And that requires drawing attention to what is and why it's not working. Some of the statistics that shocked me that I share when I give talks is over 70% of counties in the US don't have a single endocrinologist. This is a disease that must be self-managed. 5 to 7% of people with this condition ever see an educator, right? There's just this long list of, hey, the things we need are not available and we need to do better. When we talk about communicating, then we talk about finding your community. Then this is both an opportunity to advocate, but also to improve your own health. Coming from traditional healthcare, I didn't fully understand how important connecting people with this particular condition to other people with this condition is. And the feedback we got, first, we were surprised by the number of people we were caring for that didn't have anyone in their life that also lived with this condition. We began hosting events, and you know this, Scott, because you host them and you do a wonderful job, but we started by hosting our own events, cooking classes and webinars, and just opportunities for people to get together because we recognize the importance of connection. And then we started to incorporate it into our care model where we said everyone should be prescribed community from the start, right? So this is another opportunity where I'd love to see all of diabetes clinics begin to recognize the importance of connecting people to community. I think there's wonderful opportunities in the advancements of the technologies that people are wearing. I think CGMs, automated insulin delivery devices, are only getting better. And so we see a lot of promise in that. And I'm just amazed with how our rapidly evolving understanding of biology is getting us closer every day to really what we need, which is a potential cure to this condition. So I think all of that, and locally, the impact that we're hearing from the people we care for, like just how these common sense things are making a difference, has me really, I'm really optimistic that there's a lot of room to grow, and there's a lot of people working really hard to do what they can to help advance this field and improve the health of people with type 1 diabetes.
Yeah, that's great. And it's great to hear that there are so many opportunities. Like, I still feel like I have a lot to be hopeful for in my life with type 1 diabetes.
Yeah, we have a lot of work to do. Like we, in some sense, I'd say Blue Circle Health shouldn't even exist, right? We shouldn't need a philanthropically funded care program to fill in the gaps, especially since we're paying as a nation over $19,000 per person with type 1. So it's not that we're underspent, and the average person with type 1 then spends thousands out of pocket. So it's not like we don't spend enough money to dramatically improve hundreds of thousands of lives right now. It's that we spend it on the wrong things.
Yeah. Is there anything that I haven't asked about that you want to be sure to cover in our conversation today as we think about starting to wrap things up here?
I think I would say one more thing, which is I've worked across many, let's call them disease domains. Like I've helped in all different types of cancers and heart disease and childbirth and end of life care and surgical care, like dozens at this point. And it's always interesting to get to know the professional and the patient communities when you enter into a new space. And I'm often the newcomer. And I will say that I've been blown away by how generous and supportive and caring both the professional, but also the professional type 1 related community, but also the people who live with the condition. The way they've welcomed us and this new concept with open arms, the way they've connected us to other organizations that have helped amplify our reach, and organizations like Beyond and Breakthrough and I've just and ADA, and there's we now have organized 17 nonprofits to all come together and to share a calendar and to share messaging. And I just haven't seen that in other parts of healthcare. So I think that one of the greatest assets that this community has is the community. And I think if we're going to make real progress in both drawing attention to the fact that care can and should be better, and in lowering the price of drugs and improving access via insurance policies to devices, I think it's going to be when this community comes together and shares one voice. And I've never come across a community as capable of doing that. And I just think for me, it's going to be really fun to see how this community works together to continue to drive progress and change.
Amazing. Well, Len, we've covered a lot today. If you had to pick a few key takeaways from our conversation, what would those be?
Number one, fee-for-service reimbursement for healthcare is the number one cause of people being sicker than they need to be in this country. Number two, there is a role for philanthropy to fund into existence a single condition value-based care program that can prove better results are possible at lower cost. And we're working on that. Number three, this community is amazing, and I am grateful to everything they've done to pick us up and to connect us. And I'm even more excited for what they're going to do next and to be a part of it. And number four, Scott, thank you for everything you do for Blue Circle Health, but for the community. We met you because you were already a pillar in this community. And more than one person said, you need to talk to Scott if you're doing what you're doing. And I couldn't be more grateful that we've got you on the team.
Thank you. Honored to be here. And I appreciate you building such a place as Blue Circle Health. It's It's very fulfilling for me to devote my time and energy to this organization. Thank you so much for talking with us today. I really appreciate it. And thank you for all the work that you're doing at Blue Circle Health. It's needed.
Yeah, it's my pleasure. Thanks, Scott. Appreciate it.
If you enjoyed this episode, think about leaving us a review and subscribing to the podcast. You can also check out the video version on the Blue Circle Health YouTube channel. And be sure to tune in for our next episode, where we're going to get some expert help in talking about our type 1 diabetes with others. I hope you'll join us. Until then, keep living well with T1D.